Our next speaker, our first speaker of this evening session is already amongst. It's known spinal disorders are the most frequent cause for the doctor's visit worldwide. A very, very known fact. And to enlighten us on the subject, we have with us the well-renowned and finest resource person from the beautiful country of Nepal, Dr. Sunil Kumar Paudel. Dr. Sunil is world's first naturopathy and pain physician with his expertise on spine. Post BNYs, he did his postgraduate diploma in pain management from UK, fellowship in pain management from Harvard, USA. He's the ex-owner, founder, director, Prana Spa USA, founder of 10 hospitals, more than 20 spas, wellness clinics around US Virgin Islands, British Virgin Islands, Kathmandu, etc. Today, he'll be sharing his expert knowledge on versus integrative naturopathic medicine management for lumbar spinal stenosis case series. I welcome you, sir, and invite you to share your expert knowledge.
Thank you. Thank you very much. Thank you for inviting me to this conference. Yeah, truly well said. Spinal disorders are the most frequent cause for doctor's visit. It's not headache, it's not common cold, or it's not neither fever for doctor's frequent visit. It's spinal disorders. So the spinal pain, any disorders related with spine are so frequent. We are evolving as a human being. We are not used to sitting at one place, but because of the technology and in this new era, we have to sit. Everything happens sitting. Earlier, when we had to do, we had to cook food, we had to go and cultivate. Few hundred years back, okay, we had to cultivate, we had to put water to those plants, we had to yield all those crops, we had to go miles for water and any food. Nowadays everything happens with just your cell phone, just sitting. So that's creating tremendous pressure in the spine, and it's nothing but posture that's causing all these disorders. Okay, so it's a long session today. So without wasting any time, let me share my screen. I hope it's visible. Is it?
Yes, sir, it is visible.
Okay, so today we are discussing about surgery versus integrative naturopathy for lumbar spinal stenosis. Lumbar spinal stenosis, one of the most frequent cause for back pain, mainly low back pain. Okay, so we'll discuss what is lumbar spinal stenosis and what are the management protocols. Lots of us might be treating low back pain and lumbar spinal stenosis even without knowing what we are treating. Okay, so naturopathy is very effective in this, though there has not been any research, because most of, as I told you, most of us are managing it without even knowing it. Okay, so let's go and learn what lumbar spinal stenosis is. Okay, so it refers to the narrowing of the spinal canal, okay, leading to compression of the neurovascular bundle due to many causes. The most frequent causes being the disc herniation, what we call disc prolapse, okay, slip disc, all these things. It's all the same. Slip disc or disc herniation or disc prolapse are all the same. So the lumbar spinal stenosis, the prevalence is around 11% of the general population. That's a huge number. Okay, so this is the spinal canal. Okay, so in the spine, at the back, at the posterior side of the vertebra, we have got a triangular canal, what we call spinal canal. Okay, so in lumbar area, this canal is called lumbar spinal canal. Okay, this is also called central canal. Many literature or many experts, many specialists speak it in many terms. Okay, so this is normal canal, and when there is narrowing, okay, there might be many causes narrowing this spinal canal. Okay, so any causes in this image, in this graphic image, as we can see on the left, this is because of the osteophyte over here at L3. This is the posterior end plate osteophyte compressing the spinal canal. Okay, so over here, there is this osteophyte could be because of lumbar spondylosis, could be other causes, other inflammatory diseases as well. And over here, we can see spinal stenosis behind in the spinal canal in L4 vertebra and at L5 as well. Okay, so those people who are used to seeing MRIs, it's very easy to identify. So this is graphic image, same thing I'm showing you over here in an MRI. This is T2 sagittal MRI. So over here we can see this is over here there is slight listhesis. You can say grade 1 enterolisthesis of this vertebra. And then we can see there is swelling of ligamentum flavi over here, what we call hypertrophic ligamentum flavi. Okay, so there is listhesis, slight pseudo protrusion. Okay, this is called pseudo protrusion. Those people who have already joined our spinal diagnosis and management course, it will be very easy. Those people who are used to seeing an MRI, it will be easy. For those, you can learn, keep learning, no problem. So the spinal stenosis, the cause of spinal stenosis in this case is pseudo protrusion, enterolisthesis, and the ligamentum flavi hypertrophy. Okay, there might be many causes, but today we are going into the most frequent cause, that is disc herniation, what we call slip disc. Very frequent cause of spinal stenosis. Okay. So I'm showing you a graphic image again. Okay, this is the left half of the image is healthy one, and right half is unhealthy. So I'm showing you what and all can cause lumbar spinal stenosis. So over here, this is very healthy spinal cord over here on the left, and on the right side, you can see the spinal canal is compressed slightly. So over here, we can see disc protrusion can cause, because disc protrusion posterocentral or posterolateral, paramedian, what we call paracentral as well. So all this disc protrusion can cause spinal stenosis, okay, or the narrowing of the spinal canal. So over here, disc protrusion can cause that, mainly posterocentral, and paramedian, what we call paracentral as well. So that can cause spinal stenosis. And then there is something called ligamentum flavi over here at the posterior rim, okay, at the posterior arch of our vertebrae. So this ligamentum, any hypertrophy or calcification of ligamentum flavi over here can also cause spinal stenosis. And there is called PLL, posterior longitudinal ligament over here. So if posterior longitudinal ligament gets calcified or gets hypertrophied, that also can lead to spinal canal stenosis. Then sometimes arthritis or inflammatory arthritis, spondyloarthropathy, what we call ankylosing spondylitis, all these things can also cause large osteophytes. So osteophytes also can encroach into the spinal canal. Okay, so that can also lead to spinal stenosis. But remember, the most frequent cause in our country or elsewhere all around the world is disc prolapse, or what we call slip disc. Disc herniation is the technical term. Okay, so on the left side, this is normal spinal canal, lumbar spinal canal. This is normal lumbar spinal canal, as you can see in this MRI. This is T2 axial view, what we call transverse view as well. So this is the stenosis. So over here, same thing I'm showing you, the same thing, that same graphic image. Over here, it's clear. You can see the thecal sac, and you can see the nerve roots, beautiful. Okay, you can see epidural fat, a beautiful bean-shaped disc. This what we would want to see in an MRI. This is posterior side, and this is anterior. Okay, this is front and this is back. So this is the spinal canal, and this is the thecal sac. This is where the nerve roots are playing around over here. The nerve roots reside over here. Okay, these are the neural foramina, and neural foramina don't count into spinal stenosis. That's lateral canal stenosis or foraminal stenosis. So this area is the spinal canal. This triangular area, as you can see, is the spinal canal, and many causes can lead to spinal stenosis. So let's see one of our patient's image. So over here, what we can see, this is posterocentral and bilateral paramedian disc protrusion. So can you see this white spinal canal? This is T2 image. T2 image shows the S2O, water, and the fat white. Okay, so anything you see in these two images that are white are either water or fat. Okay, if you have joined our spinal diagnosis and management course, it will be a piece of cake for you, because this is what we teach. So over here, what we see, you can see this black, dark, okay, what we call hypointense. Okay, this shadow, hypointense shadow, this is ligamentum flavi. So over here, ligamentum flavi is also compressing the spinal canal from either side. And there is disc protrusion, that's for sure, right? Disc protrusion is pressing it from anteriorly, and ligamentum flavi is pressing it from posteriorly. That is leading it to spinal canal stenosis. And this person is suffering from severe spinal canal stenosis, moderate or moderate to severe. We cannot see thecal sac, we cannot see nerve roots. So the moment we cannot see nerve roots and thecal sac, that's severe spinal canal stenosis. And we can see there is facet arthrosis as well. So that's also leading to lateral recess, and that's leading to lateral recess and also foraminal stenosis. But we are going into spinal canal stenosis. We cannot see the thecal sac, we cannot see the nerve roots. So this is pure spinal canal stenosis over here. I'm not going into depth. In depth, we'll study and we'll learn in our sessions. So what are the signs and symptoms? How it is characterized? So lumbar spinal stenosis is characterized by low back pain. Yes, LBP. Okay, low back pain is one of the most frequent cause, and that's not it. Okay, radicular pain. Okay, radicular pain means sciatic kind of pain. The pain goes to the leg. The pain always should go to the leg. One, unilateral or bilateral, doesn't matter. Okay, depending upon the disc herniation, unilateral or bilateral. So the radicular pain, the sciatic radicular pain is nothing but sciatic kind of pain, gets aggravated by walking, standing. That's called extension. If the pain gets aggravated by extension, that means you can suspect lumbar spinal stenosis, and it needs to be relieved by sitting or flexion. The moment the sciatic pain gets relieved with flexion, that could be lumbar spinal stenosis. And not only that, okay, low back pain, sciatic kind of pain that gets aggravated by extension or walking, standing, and gets better on flexion or sitting. Okay, not only that, it limits mobility and it reduces balance capabilities as well. Okay, so these are typical. The moment the lady stands and walks, okay, or straightens her back, so that provokes the symptom, the sciatic kind of symptom. The moment she starts bending forward, that's why any patient coming to you by bending forward, walking, bending forward, you need to be suspecting lumbar spinal stenosis. So that's why they bend forward to walk. Okay, and they feel even better while sitting. This is typical presentation. And as we know, lumbar spinal stenosis is a major public health and socioeconomic problem that is associated with poorest quality of life. Okay, amongst all musculoskeletal disorders, lumbar spinal stenosis is one of the major reasons, okay, for poorest quality of life, and this can easily lead to disability. We have seen thousands of patients in our clinic and hospitals with disability and even paralysis. Okay, so lumbar spinal stenosis is one of the most common causes of non-traumatic spinal cord injuries as well. Okay, spinal cord injuries are of many kinds. One of them is non-traumatic spinal cord injuries. This is one of the most frequent cause of non-traumatic spinal cord injuries. So lumbar spinal stenosis symptoms usually start slowly and get worse over time. So the onset is always gradual, not sudden onset. Usually sudden onset can be there, but rare, only in acute disc herniations. It could be acute as well. So there will be neurogenic claudication. What you call neurogenic claudication is the sciatic kind of pain while standing or walking. Okay, mainly in walking. When you get pain in your legs, tightness in your legs while walking, that's neurogenic claudication. So it's not vascular. So neurological deficits are very common. And the disability, can you focus on disability? Up to 43% of the patients report some weakness of lower limbs. That's a huge number. You cannot see it anywhere else. So lumbar spinal stenosis is one of the leading cause of disability. Lumbar spinal stenosis also has high potential to develop cauda equina or conus medullare syndrome that requires immediate surgery. Okay, so the diagnosis of lumbar spinal stenosis is made on history taking, physical, and radiological examination. In our spinal diagnosis and management sessions, we teach you how to see MRIs, how to do physical, orthopedic, and neurological examination, how to see X-rays, everything. So this is how there are lots of tests. I'm not going into tests. So there are lots of tests. So we do physical, orthopedic, and neurological examination and diagnose spinal stenosis. So on radiological, the gold standard is an MRI. Okay, higher the Tesla, better. Okay, if 3 Tesla MRI is available, that's fantastic because it allows you to see the nerve roots easily. So this is one more. I'm repeating the MRI. Okay, T2 sagittal view and T2 axial or transverse view. So that shows spinal stenosis over here. So what about the management part? Modern medical management for lumbar spinal stenosis are not very effective and they are often unsatisfactory. Okay, this is a bitter truth. No matter whether it is medication or surgery, modern medical managements have not been up to the point at all. Okay, so lumbar spinal stenosis is major reason for surgery and failed back surgery syndrome. Usually, we used to use this term FBSS, failed back surgery syndrome, but nowadays it is called post-surgical spine syndrome as well. Okay, so you need to be very aware that there is the modern medical management has almost failed in most of the cases. I'm not saying that you can refer to these researches. The references are given below in blue, okay, in all slides. So even in my practice, I see lots of spinal stenosis patients that are not happy with surgeons, that are not happy with orthopedics or neurologists. They come to me frequently. I see at least 15 to 20% every day. Okay, so major lumbar spinal stenosis also is the major reason for surgery and also major reason for failed back surgery syndrome. Okay, and the efficacy of various kind of surgeries treating lumbar spinal stenosis remains unclear. So among these references, there are meta-analysis and systematic reviews as well. Okay, so what do those meta-analysis say? The various kind of surgery, efficacy of the various kind of surgery in treating lumbar spinal stenosis remains unclear till now. Okay, results of many high quality studies and large scale systematic reviews are inconclusive. Remember, inconclusive. So before referring a patient for surgery, remember, are you going to spoil that patient? Are you going to spoil? Are you playing with that patient's life? Because there are chances it might fail. So surgery complications are frequent and dreadful. Okay, this is what the researchers say, and this is what I see every day. Let's see some patients. But why do people go for surgery? Okay, the major reason why do people go for surgery is poor pain management. They cannot manage the pain. Okay, poor knowledge of pain management amongst the specialists. Even the surgeons don't know how to manage the pain, and they are least interested. That's not how they are going to make money, are they? Okay, that's not their expertise as well. So lack of human resource in pain management in tertiary care hospital or secondary care hospital is also one of the reasons. Once you don't have got anyone managing your pain, then it might become difficult, and it creates fear amongst patients and doctors. Okay, in my clinical practice, I don't like the patient who come to me, I get back pain and I get pain while doing this and that. I love the patient who tell me, doctor, can you kill me? My pain is that much. Okay, I love those kind of patients. I love that kind of challenge. And they are, believe me, they are very easy to manage if we know. Okay, So fear amongst the patient and as well as among the doctor. Okay, we might feel, oh, maybe it might lead to podicuna, it might lead to paralysis. Believe me, it's very easy. Okay, so fear amongst the patient and as well as amongst the doctor is one of the reasons, because we are not educated. Even doctors are not educated. Lots of surgeons don't know it can be managed very easily. Okay, and the hospitals are dominated by surgeons. That is another reason people go for surgery. Okay, most of the hospitals, who are the most famous doctors? Surgeons. Okay, and why patient go for surgery? Because of the fear and because they are unable to bear pain during first week or first fortnight. If you can bear the pain for 15 days, no one would like to go under knife. Okay, no one would like to go for surgery. So pain management allows me to manage their pain, and their belief on me also is another thing, because the pain management increases that, enhances the belief as well. Lack of training and courses in this subject as well. There is not even single course developed in spinal diagnosis and pain management all around the world. Okay, people learn thousands of things, but they don't learn the basics. It's very easy, but there are not many courses. Lack of robust conservative protocol. All over the world, I've seen there is lack of robust conservative protocol. There have been thousands of research I showed you, but there have been very lack of robust conservative protocol. And the guidelines, our guidelines, red flags, yellow flags protocols, our guidelines are outdated. They are outdated. That's another reason they will have to go under surgery and fail. Okay, so I am showing you, I'm giving you reference a few hundreds. I've got more than 100 researches that say, that justify Macamson's, A.L. Macamson's conclusion. Okay, so in Acta Orthopedica Scandinavia, so he has mentioned clearly that never go for surgery without exhausting extensive conservative management. Because why? Because surgery is no better than conservative management. Okay, it's not only my experience, also all these hundreds of researchers, that's what they did. Never go for surgery without exhausting extensive conservative management. Okay, so and then people go for surgery, and there is repeated spinal surgery is repeated as well. Okay, so I'm referring to failed back surgery syndrome, a review article in Asian Spinal Journal recently. Okay, it was 2018 research. It says around 50% of the primary surgeries, first spinal surgeries, are successful. Around 50% are only successful. No more than, and this prolapsed spinal stenosis is caused by posture. The surgeon is not going to teach you how to maintain your posture, and it comes back again. So no more than 30% of second surgery will be successful. No more than 15% of third surgery will be successful, and no more than 5% of the fourth surgery will be successful. Can you see? It's a least number. So why do you send patient to surgery? Because we don't know. We are not educated in this field. Okay. So efficacy of integrative multimodal conservative management has been proven in multiple studies. There are multiple studies that has proven that integrative multimodal conservative management is successful. Without surgeries, we can successfully treat spinal stenosis. But there has not been even one study with yoga and nature care approach. Okay, that's so unfortunate. But I've been treating since more than 15 years. I've been treating spinal stenosis with integrative naturopathic approach, and believe me, I'll show you a few cases. Okay, it is very successful. We can treat lots of patients. Okay, so this is so let's go and find out few cases. So this is all about not researches and me teaching you. That we'll do somewhere later. So for the timing, let me teach you. Let's discuss few cases. Okay, for the timing today, I've got 4 cases. I've got hundreds of like this. Okay, more than hundreds. So the first case is surgery case. This lady, okay, who didn't want her name to be revealed, went to a most famous neurosurgeon over here, and she was diagnosed with spinal canal stenosis at L4, L3, L4, L4, L5. Okay, and this is the diagnosis discharge with what was she done? Multi-level laminectomy. So what is laminectomy? I'm not going to teach you. We don't have much time. So there is something wrong over here. The surgeon did something wrong. Okay, what did he do? Okay, the pain was little bit too much in last 10 to 12 days. Okay, she had got sciatic kind of pain, but it was little bit more in last 10 to 12 days. So what Nackhamson told us, okay, never go for surgery without exhausting extensive conservative management. The surgeon didn't think so, so the surgeon operated because that's what they know, right? And as I told you, hospitals are dominated by surgeons. She went for multi-level laminectomy. This is her case history. Okay, and as I will focus you, okay, I'll focus where the case history, unable to walk, stand, and she is wheelchair bound. Okay, and this is post-surgical evaluation. Okay, during post-surgical evaluation, she told me clearly surgery was a failure. The next day on, she could never walk, she could never stand, and she is wheelchair ridden. It is by no means ridiculing surgery or anything. I'm just educating you. Okay, so I don't mean to say something is superior, something is inferior. Okay, so we are trying, let's try to have a balanced view. And before surgery, she could do her daily duties, work or walk, or okay, but she's not able to do it all. And now she has developed frequent falls also. Okay, so what was the thing? Okay, let's go into pre and post surgical MRIs now. I evaluated her MRIs again. So this was 2019 pre-surgical evaluation. We can see this is L543. These are all T2 sagittal images. Okay, very clear to tell you. You can see L34, there is posterocentral disc herniation. L45, there is posterocentral disc herniation, and there is spinal stenosis. Okay, so this is pre-surgical and post-surgical. You can see again. Can you see over here? The spinal stenosis again the same. So the approach was wrong. Could be the surgery doesn't clean up all the spinal canal space at all. It is impossible because that space is something like that. It is difficult, very difficult to clean that up. So despite of his best effort, see, the surgery was totally failure. 2019, and in 2021 it looks even worse. Can you focus? I have focused over here. L34, L45. Okay, L34, L45. So the surgery was a failure. Disc herniation is still exists. Spinal canal stenosis still exists. Okay, now let me show you another thing. So this is L45. Okay, there was no listhesis at all. Now this was pre-surgical 2019. Now in post-surgical, can you see over here? Post-surgical, you can see there is enterolisthesis of L4 over L5, grade 1. So she came to me with disability. So this is, so that's what, she was unable to walk, stand, wheelchair ridden after surgery because it was a failed back surgery. So what she would do? She would go for another surgery. The success rate, as Asian Spine Journal says, success rate second surgery 30%, third surgery 15%, fourth surgery 5%. Okay, she did not go for surgery. She came for rehab. Okay, now there was a gentleman who is rich and he went for 3 surgeries. So this is the surgery scar. This is the gentleman. So let's go and see him. Okay, so the first surgery was done in 2001. Okay, and second surgery was done in 2008. And he was not happy with the outcome. Then he went to Delhi for third surgery. Okay, now can you see? Let's see this patient. Okay, let's see this patient. How does he do with third surgery, after third surgery? Okay. So let's see a quick video. So this is the patient with third surgery. Okay. So you can see his foot drop. Okay, bilateral foot drop. He cannot walk without stick. Very difficult to walk without stick. In next video, I'll show you how does he walk without stick. Okay. See, this is how he walks without stick. Very difficult. There is radiation still, and basically he cannot walk more than few steps. This is the disability he has gone into after 3 surgeries. Okay. So as I told you, there are motor deficits, gait problem. Okay, his muscle power is around 2, and he has got urge incontinence. He cannot control his urine. This is the result of surgery. This is what we are looking for. No. Okay. So then let's see. We saw a few post-surgical cases. Let's go into integrative naturopathic management. L4-5 severe herniated lumbar disc with grade 4 caudal migration. Okay. I'm focusing on before and after. Okay. So after integrative management, this was the case at L4-5. There was huge balloon, large posterocentral disc prolapse, disc herniation with caudal migration. Can you see inferior migration of the disc fragment? And this is after the integrative naturopathic management. Okay, this is after integrative naturopathic management. And these are T2 sagittal images, and these are T2 axial image. Can you see this fragment? This fragment is totally lost over here after integrative naturopathic treatment. Okay, so this is the radiologist report. Okay, so he has given, the radiologist has given totally comprehensive comparative report, and the report says only a small rudimentary caudally migrated component is seen in the current study, and there is no nerve root compression seen in current study. This is post naturopathic rehab. Okay, so the patient was totally cured. Okay, pain scale, okay, numeric pain rating scale was 0, no radiation, no paresthesia, neurology was normal, functional ability fantastic, totally normal. Okay, as we are out of time, I'm doing it slightly quick. Okay, so let's go for case 4. Okay, what about the lumbar spinal stenosis patient with paralysis? Okay, this was without paralysis. This case was without paralysis, though disc prolapse, disc herniation was used. So let's see a patient with paralysis treated with naturopathic approach. Okay, so this is a patient. Okay, he gave his consent, so I'm giving his name. Okay, so I'm not going into case history. Straight away, let's see the MRI. So there are disc disease in L3-4, L4-5, L5S1. So over here we can see more at L4-5 and L5S1 with spinal canal stenosis. Right over here you can see the disc fragment in the spinal canal. Okay, so let's see the patient. How did he come to me? Okay, I'm pausing over here. You can see, you can focus on the toes. He cannot extend his toe. I'm doing heel walk test. Okay, he is not able to extend his toe. Okay, let's see on the right foot. So dorsiflexors are also weak. You can see dorsiflexors are also weak. He is not able to take his toe up. Okay, dorsiflexors are weak. Extensor hallucis longus is also weak. Okay, so and I asked him to walk on the toe now, toe walking. Can you see how he limps? It's because of the weakness of the plantar flexors. The calf muscles are paralyzed. Okay, that's the reason. Okay.
Actually, Dr. Sunil, your video is not visible, so maybe you can skip forward. Yeah.
Okay.
Already we are on time. Yeah.
Okay. Is it visible now?
Not really. पहले का video भी नहीं दिखा रहा.
Okay. So let me show you.
And we are almost time. Just try to conclude in another 3 minutes.
Okay. I'll do that. So let me show you the video quickly. Okay, can you see this video?
Yes.
Okay,
yes,
so the dorsiflexors is very weak on the right, and even big toe, we cannot. You can see external hallucis longus is also weak. So he's walking on the toe. He cannot because his plantar flexor are also weak. Okay. This was the case, lumbar spinal stenosis with paralyzed leg. Okay. So this is the patient after 2.5 months. The same patient walking fantastic on toe walk, heel walk, nothing bothers him. Okay, he can walk on the toe, he can walk on the heel, no problem at all. Okay, even paralyzed patients after spinal stenosis can be cured with integrated naturopathic approach. Okay, let's just conclude now. We don't have, but we are out of time. So let's just conclude. So he was totally cured. His NPRS pain scale was 8, now 0. Radiation severe, none. Paresthesia, none. Neurological deficit, no. Functional ability is normal. He's working in his shop. Heel and toe walk, normal. So, okay. So what were the protocol? The protocol were counseling, because it is the confidence within you that is going to convince the patient. Conservative pain management, SOS. If the patient comes to you with severe pain, we can manage with that pain management for a few days. Postural care, rest in specific poses. There are specific poses I have postulated that help to not only in pain management, also in treatment. Specific yoga and exercises, physical therapy modalities, manual therapy and adjustment, massages, acupuncture, hydrotherapy modalities. Okay, unloaded harness walking therapy, electric muscle stimulation, supplement and herbs, and the admission. How long it might take? 1 week to 1 month. These patients were treated for 1 month in admission, and he was coming twice a week for 2 months. Okay, before he was cured. So in future, I'll be coming up with a book on all these evidences, spine care, and we might be getting a course to you as soon as possible as well. Okay. Any questions? Do you have the time for questions?
Hello. Hello.
Yeah. Yes.
Yeah. So there is a one question, like what is the treatment protocol in short, if you can tell around exercises? What exercises you can prescribe?
Okay. During in spinal canal stenosis, people cannot do any extension exercises at all. That's very typical of spinal stenosis. So basically, if we have to talk about exercises, if you know yoga, Pavan Muktasana, okay, but we may have to use core exercises. We may have to use isometric exercises, but for the timing, let's begin with a resting position. I'll always begin with rest position, that's inflection, and then I'll go with isometrics, then heel slides, then few core exercises, and as tolerated, I would go for flexion exercises. Flexion exercises are the key in spinal stenosis.
Thank you, sir. So as we are running short of time, so here we'll be concluding with it.
Okay. Yeah.
You have really entitled as practically how we can deal spine cases without even thinking about surgery, because once people are in pain, the first line of treatment they go and think about is managing through surgery or anything. So it gives more confidence and all. Thank you, sir, for your very informative session and your valuable time. Thank you.
Thank you very much.
Our next upcoming speaker is already amongst us. And it said, like, well, as long as there is breath in our lungs, our story is still being written. And today, in this COVID times, lung health has become the subject of highest concern and interest. And to share his expert knowledge in this regard, we have amongst us one of Dr. Lalit Kumar Anande. Post his MBBS, Dr. Lalit has worked with as a medical officer, CMO in GTB Hospital, Savory, as head thoracic surgical department. He has been resource person at various forums and colleges on the subject of TB. He was awarded for his philanthropic work in the field of TB by Government of Bihar and was selected as Mumbai Heroes by Mumbai Mirrors of Time Groups. Currently, he is working as medical superintendent at Savory TB Hospital. Today, he'll be enlightening us on antioxidant therapies in lung health. I welcome you, sir, Dr. Lalit Kumar Anande.
Yeah. Thank you for inviting me on this program with so many learned people out being here. Myself, Dr. Lalit Kumar Anande. Um, I have worked in the most disastrous disease this planet Earth has ever seen. We are talking about COVID now, and terrified by the COVID things which is happening since the last 1.5 year. But for the last 30 years, 3 decades, I've spent in something which is so similar, every inch by millimeter, similar to COVID. Every damn thing which we saw in COVID times, I saw it for the last 30 years in one of the most disastrous disease mankind has ever seen. And that is tuberculosis. I worked in TB of the lungs. Of course, every TB affects everywhere the same way the way COVID does. Majorly lungs, the same way COVID does, damages the lungs with those fibrosis, those complications called pneumothorax, which are happening now, just like COVID does. It does cause the stigma, the way COVID does. You become a lonely person with no friends, no relatives besides you, just you and your bed besides which you are living, just the way COVID does. I've seen people die and later on being in the mortuary, their bodies for a long time, been a part of their cremation also, because nobody wanted to come and meet them, just like COVID does. So, having worked in this thing for the last 30 years and having faced failures a lot, which affected me. Failures means, you know how many people die in COVID. Just compare it with TB. The figure is official figure, they say, at least in India, forget about the world, is somewhere around 4.5 lakhs officially. Unofficially, things go more off than that. It is somewhere near 6 lakhs or something plus. If you just go on dividing it per month, I am talking about per year. If you just go on dividing it per month, per day, per hour, per second, it is a mammoth figure. The world is really concerned about the way TB has been spreading, an airborne disease of the most infectious kind of nature. Uh, Having worked in that thing with all those limited kind of antibiotics what are given to us to treat TB, it's not that it is not a successful therapy, it is a good therapy, but yet I saw it graduating in front of me, the bacilli becoming more smart. Now, out of 13 drugs, we prefer to give them 4 minimum antibiotics. That too, not like other diseases for maybe 10 or 20 days or something antibiotic coverage. A single antibiotic or 2 antibiotics, usually it is given for other kind of disease. But here, minimum 4, maybe 6 antibiotics, minimum for maybe now in the government program, it is 6 months. Previously, we used to be giving them primary line of treatment for 9 months. But since 1997, 2001, 2003, 2006, 2009, something went on happening. Some mutations went on happening. The bacilli became more and more and more resistant to the drugs. So out of 13, what we choices we went on having previously, we used to give the ones which were with least adverse reactions. But then, since the mutations went on happening, we had to give some antibiotics which we did not like, but yet with the adverse reactions also, more and more antibiotics with more and more adverse reactions were given. It has come to a point where we now see people who are resistant to not one or two, but 8, 10, maybe 10 plus. When it is 10 plus, you are not left with much antibiotics, because minimum we have to give 4 or 6 antibiotics at a single given point of time. So if they are resistant to 10, 11, 12 antibiotics, it graduated from a word called simple TB to MDR TB, multiple drug resistant TB. From there on to XDR, extreme drug resistant TB. From there on to extreme drug XDR TB. In 2012, a bomb blast happened, means a news came that they have found Mycobacterium, the causative organism of TB, resistant to practically all known drugs. Total drug resistant. Having seen all this dangerous forms of TB coming out, and having worked in the surgical side also of thoracic surgery with lot many people of pulmonary TB having complications of TB, something called as pneumothorax. Then pyeopneumothorax means empyema, a very bad thing. I mean, pus collecting inside the chest, and the usual procedures of is to insert an intercostal tube inside the chest from where the pus flows out into a intercostal bag. I have personally in my lifetime inserted more than 2.5 lakhs intercostal tubes. It takes me hardly 1 to 1.5 minutes to insert an intercostal tube through which all the pus used to come out. And the book picture treatment for this is to keep the tube for maybe 1 month, 2 months. If the lung expands, good enough. But lot many people, the lung doesn't expand, and there is something called pleura on the lung, which normally a pleura is so thin. Since I've seen live lungs, I can tell you very easy for the last 30 years, a normal pleura looks like a soap bubble. It is so thin. When we open up the chest, we see something very shiny on the lungs and on the pink lungs. When we touch those lungs, it is like a sputum, just that thin kind of thing layer just comes out. That is a pleura, visceral pleura on the lungs. Now that becomes thick because of the empyema, the pus inside the chest, and that goes on releasing the pus on a daily basis. So the treatment over here is, if the lung doesn't expand, maybe 1.5 month, 2 months time, and the tube is still there, the pus is still coming out, we investigate the patient and take him for a major surgery of open thoracotomy, means open up the entire chest and remove the entire pleura. The patients referred to us were after a long time, maybe 6 months, maybe a year, maybe 2 years, or with those intercostal tubes inside, where the pleura, which as I told you, is very thin like a soap bubble, used to be as thick, 1 inch or 2 inch thickness, sticking to the lungs. To removing that pleura, the surgery is called decortication surgery, but there is a criteria for such kind of surgeries. Maybe the patient is to land up with a pneumonectomy, means the entire lung is damaged and the one lung has to be removed. But the criteria over here the patient has to meet is the other lung has to be 100% normal. The CT scan has to be done. It should show entirely one lung has to be completely normal. Secondly, the pulmonary function test has to be normal. The other investigations, of course, are like any other surgery come into play. But so many patients referred after a long time, when the tube is inserted, maybe a year, maybe 2 years, maybe 3 years later on, had the other lung also damaged, where we can't really do a supra major thoracic surgery of decortication, removal of the pleura, or pneumonectomy out here. So here, in such kind of unfit patients, we started doing something called as modified Aloysius flap surgery, which is window surgery. It is called, means in the mid axillary line, just above the diaphragm, make a hole this much, around 2 to 3 inches hole, by breaking 1 or 2 inches of the ribs, uh, a hole, and the tube is removed, because the tube itself is a cause of depression in patient roaming around with tube at home or in ward, with the pus flowing out into that bag, which is a thick pus, greenish colored, with a very foul smelling smell, all this kind of thing, and no chances of improving. So we removed the tube and started making a hole inside the such chronic patients, just above the diaphragm. Now the pus used to just come out of that hole, and the patient used to have a dressing on that hole. With the shirt and all, he could move around here and there. But that foul smelling, the pus used to continuously go on flowing. We used to irrigate those holes with normal saline, betadine mixed saline, so many things. We used to irrigate so that the cleanliness has to be maintained. We used to train the patient in irrigation of all this kind of thing. The antibiotics what we used to give, we found that they are superbugs, means the pus which is coming out from the chest is practically resistant. The organisms are resistant to all the antibiotics around. No choice left in such kind of patients. What to do? Somewhere around, somebody told me that why don't you irrigate these wounds with something called ozone therapy. Now that stunned me. What is ozone therapy? But when I went into the details of this thing, I learned about ozone being one of the best antioxidants. So that antioxidant therapy we never used to give to TB patients, just the antibiotics and some vitamins here and there. So when I started using cleaning that wound with liquid, means water mixed with ozone gas, and irrigating that wound, I was stunned to see the results in 3 days flat. Means we used to have almost a line of 100 plus patients to irrigate those wounds, to clean those wounds, and all those kind of things, pus flowing out on a daily basis, twice, thrice. After irrigating that wound, that window, means inside the lung is also seen, the thickened pleura is also seen, the pus is also flowing, all those kind of things. In 3 days flat, when patients started saying and coming to us with saying that the pus has vanished, I was stunned. I mean, such a easy thing out there, and we never were told about it. So started using it more and more with these patients, and the patients slowly, over a week, 2 weeks time, when they started coming and telling us that forget about the pus which has vanished, our appetite has increased remarkably. In TB patients, pulmonary TB patients, all of the appetite has, I mean, there is nothing called appetite over there. The entire plate, what is given to them, 80% to 90% of the plate, it is not eaten at all. Their appetite has gone down. Here, they said that the appetite has suddenly increased after 15-20 days of this pleural irrigation being done with ozonated saline. They said that we used to eat half a chapati per day. Now we are eating 8 chapatis at a single given point. That stunned us. We had not expected something like this. Then the anti-TB drugs induce arthritic pains in the joints, which is very common with the AKT, anti-TB drugs. They said that that has vanished. Okay, fantastic. Then their weights increase. In a month's time, we saw patients having weight gain of 10 kgs. That was surprising to us. And they said that their sleep, which was a disturbed sleep, they had depression, suicidal kind of tendency because of this prolonged sickness and all this, has improved a lot. Now they are sleeping for 8 to 9 hours per day. That surprised us very much. Now This was only done to the patients who have undergone surgery of this window kind of flap, modified Ehlers flap, a hole made in the chest to drain the pus. So we thought, can we give this kind of things, ozone therapy, to the normal patients which are there, which have not undergone surgeries. There we were trained uh, by a group of experts to give ozone therapy into such kind of patients. How to give it? It was rectal insufflation, like an enema. The ozone, it is basically a machine. Oxygen goes into that machine. Oxygen is O2. It goes into the machine. The oxygen atom splits. The O2 splits, becomes O1, O1, O1. It rejoins again, and when it rejoins, uh, 97% what comes out is O2. 3% is O3. Means one more oxygen atom has joined over there, but it is very unstable. Oxygen is a stable gas, but ozone O3 is very unstable. Hardly 2 to 10 minute seconds, it just splits away from them. So in that period, if it is given to that patient, basically it is an oxygen therapy. Oxygen goes, but that 3% odd O3, which is still stable in that short window period, if it is given to the patient, it creates wonder. Here we were giving it to ozonated saline, but now we, in a normal patients which are there who did not have surgery, we started giving this thing rectally, like an enema. And I tell you, I saw the one of the first patients. So when we tried this thing was a girl who was a singer in Gujarati TV serials, and she became ill with tuberculosis. Her lung got damaged, multiple drug-resistant TB, graduating to extreme drug-resistant TB. She was lying at her home for 18 months continuously, 18 months continuously, every second on oxygen at home. And she was brought to the hospital because now there's no point keeping it at home. She was bedridden completely. Um, all those passing stools, urine, everything out there, not eating well, had become a skeletal kind of thing, and was brought there to die. But when we started giving her ozone therapy, I was stunned. 10 days later, when her father came and told me, आज मेरी बेटी ने मटन मांगा है खाने के लिए, मीट, non-vegetarian. I am very happy that she has gained her appetite. And when we met her, she was talking without her oxygen, nothing else. And I just looked at the X-ray, and it stunned me beyond this thing, that it defies all medical logics. That an X-ray with such a damaged lung should have been on an oxygen this thing. But here the girl is sitting in front of me and talking. Her appetite has increased. She had asked her father to get a non-veg diet and all those kind of things. So that is one wonder thing what we started seeing with this ozone therapy, and started giving in lot of TB patients who were resistant to practically many drugs. And over and above that, we are not in favor of taking medicines at all because of the adverse reactions. Many patients give up the medicines. It is a very difficult times to convince them for 2 years time to give them this drug resistant TB regime. And because of the adverse reaction, you know, you one takes anti-diabetic and hypertensive medicine lifelong. But when it comes to TB medicine, just for 2 years period, also multiple drug resistant, extreme drug resistant, they just refuse to take it. It becomes a very difficult time to convince them. Such patients who were not ready to take medicines and were having these complications, facing these complications, we started giving them ozone therapy, an antioxidant, and they improve. And it's a stunning results that many people have not even taken any of these medicines, and they completely improve. Means what? Their ESR came down from 100 plus to below 10 and 5. Their weights increased from average maybe 35. TB patients usually have a weight of 35 to under 50 or somewhere to 80 kilos or something like that. Their radiological picture did not show even an inch of millimeter, even a millimeter increase in their shadow. In fact, they decreased. Some people did their sputum culture, which is the gold standards for TB, that turned out to be negative. What more do you want? If something like this, an alternative is there, which is a very good immunity booster, and your immunity plays a vital part in your treatment, which we believe that it is only antibiotics, but the organism become very resistant to all this. Superbugs is a reality. WHO said in 2011 that no more antibiotics will be there. We'll be left with nothing. But that's a reality. Now, how to fight this war? The best way to fight this war is to boost up your immunity. That is your antioxidants in your cells, which is a reality that your cells antioxidant have reduced, and that is why this oxidative stress, which is continuously coming inside you through your mental stress, oxidative stress increase, maybe your environmental stress, air quality index being going back to worse. From it was below 80 was said to be normal. Now it is at many places 150, 200 at places like Delhi, reaching 400 and 450. That's a terrific thing. Then the pesticides being used, that is causing oxidative stress inside you. Your disease state existing, whatever, maybe diabetes, maybe caries in the teeth, increasing your oxidative stress. In COVID, what we saw, tremendous oxidative stress, which is causing all those fibros, lungs, and all those kind of things. Now, how to reduce those oxidative stress in TB, particularly with those drugs going on for 2 years time with your gut microbes and all those things, because of so many antibiotics getting damaged, the disease state causing a lot of oxidative stress. The best way to fight this oxidative stress which is there is to boost up your body with antioxidants. So we used to give antioxidants. It's not that the oral tablets, but they were slow acting. We found ozone therapy as a very fast acting antioxidant. Means if the patient I know is going to die within 7 days or something like that, if I go on giving even the other antioxidants which are available like curcumin or other things which are there, they will take their own time. Patient will not give me time. Here, something as fantastic as ozone therapy started working over there, and patient improved tremendously with this thing. There are various modes of giving this therapy. It is IV therapy also, mixed with IV fluids. Then the blood, in the blood also they extract blood. Auto hemotherapy, like same blood is given to you, your own blood, 100 to 200 ml, and through that thing ozone gas is mixed and it goes inside. Easiest way is to give it rectally like an enema through the ear, your ear insufflation, nose. There are some methods of giving it. You have to follow that thing. But I tell you, if you try this thing in patients, as a painkiller also works out fantastically. As I told you, that patients, the arthritic pain vanished when we were giving it as a pleural irrigation in this kind of patients. uh, we had, one thing, uh, we do something called BAL, bronchoalveolar lavage. In many patients who don't give sputum, we put in bronchoscope inside, suck the sputum, and give it for culture sensitivity or diagnosis of TB, the sputum and all those kind of things. Once what we did was we sucked out the sputum from the bronchoscope, and I kept there two test tubes. One test tube was a plain test tube, put in the sputum sample inside, send it for culture sensitivity. The other test tube, water was there. I mixed ozone inside, ozonated water, and the sputum sample in this two test tube, one plain and one ozonated saline, where I put in the sputum sample after collecting through the BAL, bronchoalveolar lavage, and send it for culture sensitivity. I was stunned that the first sample was positive, the second sample with ozonated saline turned out to be negative, no growth seen. So is this a kind of treatment modality that we can very fast, if through the bronchoalveolar lavage, through the bronchoscope, if we inject some saline with ozone inside, quickly within 2 minutes, patient will become negative. We have yet to try such kind of things in patients, so that TB itself will make a whole lot of difference. So will COVID also with ozone and all those modalities. Yes, I was given half an hour to talk. I have left some time for question, please.
Thank you, sir. There is a question that how much cost does it take, like, to have this ozone therapy and all?
See, ozone, basically, I started it in a very different way. Nobody had told me, but then coincidentally, it came in front of me and got in good result. But ozone was used during the First World War for wound management, and it is a fantastic treatment in infected wound. Without giving antibiotics, ozone causes a lot of healing. I was stunned to see later on results in gangrene. Gangrene can be treated with ozone therapy and all this kind of thing. For the wound, the pus, what you are seeing, we used to see liters of pus coming out from the patient's chest, minimum 500 to 700 cc daily, minimum. Thick pus, curd like viscosity. That vanished. That was a great thing. Then I came to know that in wound management, it is very much useful. Ozonated salines and all those things. Gangrene, the remarkable picture, remarkable. I mean, why we are amputing legs and all those things for this thing. Now we are seeing gangrene in post-COVID complications also, where ozone will tremendously work in this kind of patients. Yeah.
Can ozone be taken for cancer therapies? How much think about it will be working?
100%, because ozone basically is an antioxidant. What we require over here, even in cancer, the root cause, there are hundreds of diseases. We might call it malaria, we might call it dengue, we might call it TB, we might call it cancer, but at the root, there is only one disease, that is your body's antioxidant properties has come down. Means your immunity has crashed. So to boost that thing, immunity is just a word. Just a word. If you go into the things about this thing, what is it? We have to be have some electron donor which will boost up that whole thing. Ozone is a very good electron donor. Means one oxygen atom of that O3 is donated to the body, other it becomes oxygen. So in cancer therapy also, it has to work 100%. 100%. There's no doubt about it. Only problem is it's not being promoted because it is free. And one of the machines of the ozone gas was patented by some person who's so intelligent. This last 1000 years, if you go back and see 100 intelligent person, one name pops up called Nikolai Tesla. Nikolai Tesla, our electricity, alternate currents, and all those things is because of Nikolai Tesla. The shaft, lift, the car shafts, and everything, Nikolai Tesla. He has 300 patent under him. One was this ozone machine, and it was used during the World War One and all this thing for treating very, very bad wounds.
So what is the best way to use ozone in the clinical practice, whether per rectum or intravenous?
Whatever it is suitable, because intrarectal is one thing where we require a loo also to be, because the patients, once the enema is given, they certainly get that feeling of going to the loo. So that is required. Intravenous thing, it is not required, but intravenous is also good, very, very effective. So either of the things which is there, I found in our patients this pleural irrigation kind of thing and rectal, which was very fast, because we had a very high flow of patients out there. Maybe tackling in a day's time, 180 patients used to come, maybe around 8 o'clock in the morning. It's a procedure, you got to finish it off very fast. So that rectal thing happens within hardly 3 to 4 minutes. Over, next patient, next patient, next patient, depending on the situations, what things are. There are various ways of doing it. It's an entire training session of ozone therapy.
Any of the adverse effect has been seen of ozone?
I have not seen. Only thing is, once it so happened that the ozone was leaking inside the room, and there was some doctor standing close. He started getting coughing, because ozone is irritant if it goes to the nose inside. There is a technique of giving, but then that ozone gas leak, and he started vigorously coughing. But we had come to know by that time just vitamin C tablets, and within 15 minutes that coughing gone, everything neutralized, nothing else.
Okay, sir. That was really very, very informative session. Actually, we are really startled to hear that such a dangerous disease can be treated with the like antioxidant therapy in the form of ozone therapy. Thank you, sir, for your expert.
I just want to say that I did not show the presentation. Otherwise, it's a stunning thing. Stunning thing. If you just see the CT scans of the patients, which we have in plenty, of the lesions vanishing, it's not just subjective. Acha laga mujhe. Nothing subjective. With CT scans showing that the lesions vanishing completely. That's a stunning thing. Absolutely.
A practical approach. It is completely. So, thank you, sir.
Okay.
For your wonderful session.
Thank you.
Thank you. So I hope everybody got a new subject to think upon it more and to search upon it more and to learn upon it more. Now to move ahead, we have our next speaker. He's a very warm personality, so well composed with the ocean of knowledge. Yeah, Dr. Babu Joseph. After his graduation from yoga and naturopathy from Govt Yoga and Naturopathy Medical College, Hyderabad, he worked as RMO in Naturopathy Hospital, Trivandrum, and CMO in Govt Naturopathy Hospital, Kerala for 25 years. Later, he worked as a director at NIN, Pune, Ministry of Ayush, Government of India for 10 years. Post-retirement from NIN, currently he's working as founder and director at Netaji Yoga Hospital, Kochi. He was nominated as one among the founder board members of World Naturopathic Federation. He has published papers in his international journals. Today, he'll be enlightening us on the topic, orthopathy, the right suffering. Our speaker, our distinguished personality, Dr. Babu Joseph, is amongst us. I welcome you, sir.
Thank you. Can I begin?
Yes, sir.
Okay. A very good evening to one and all. I don't know how many are participating in this seminar now.
Good evening, sir.
And how many students among them approximately?
Most are students only, sir. 234 participants there in Zoom and YouTube. 60.
Students, how many?
Students will be almost student population only, most of them. And we have 60 people watching in YouTube as well.
Okay. Today the topic given to me is orthopathy. Now the senior students or maybe next outgoing students, how many of you have heard about or heard the word orthopathy or the name orthopathy? Maybe few of you might have heard, or none of you have heard about the phrase orthopathy. It is very unfortunate that the school of naturopathy in India is not familiar with the nomenclature orthopathy. The very meaning of the phrase orthopathy is the right disease. In Greek language, ortho means the right thing or the right, the straight or true. And then pathy denotes disease. Can you ever believe or think that there can be a right disease? The very common belief in our society is that a disease is a wrong action or wrong thing, or it's a negative action against a healthy life or human life. But then how the name orthopathy can be justified, or the name right disease can be justified? I think because you are naturopathy students, you will be able to agree with this name as naturopathy be the science of right disease. Here we learn that the disease itself is a process of healing. Then how the disease can be a wrong action? We have studied about the toxemia theory and the theory of elimination by the action of the vitality or the healing power. When in disease, the body is trying to eliminate the toxin, can you call it a wrong action or should you call it a right action? If you can call it a right action, then the name right disease is justified, because disease itself is a process of healing. Disease itself is the symptom of elimination of toxins. That is what we misunderstand and treat the disease just at the level of symptoms. Symptom is not the disease. It is only the external manifestation of the disease present inside, and it is only the sign of body's effort or the result of a crisis created by the body to eliminate the toxin. Very visually, visibly, we can find that vomiting is an effort of the body to eliminate the filthy remainings of the food which is remained undigested in the stomach. Similarly, when there is a diarrhea, probably we will be able to agree that it is something rotten, unwanted stuff remained in the intestine which is now getting eliminated through a diarrhea. Similarly, when you have excessive elimination through skin or lungs, like in condition of cold, you may be able to accept, approve the theory that it is also an elimination. But when body is trying to eliminate on these methods or on these ways or in different ways, how we can call that it is a wrong action? It is a right action. This was identified way back in 1820s by one naturopathy practitioner who was basically an allopath who used to practice medicine, that is Dr. Isaac Jennings. You must try to learn more about Dr. Isaac Jennings and his works. Then you will come to know on what science you are learning now, or what you have to learn in 5.5 years from a college. If you think that disease is our enemy and we have to fight the disease, then we can say that there was no use of your study in a naturopathy college. In our basic principles, it is taught to us that disease is a friend, not a foe. So when we say friend, we should understand how it is friendly with human health and life. Actually, every disease is an effort or trial to help us for a healthy living later life, or to have a very healthy feel after completion of the elimination process during a disease. So that way, we should try to learn, understand, and work basing on the principle that disease itself is a process of healing, and we shall not interfere negatively upon the effort of the body, so that the process of healing or elimination is affected, it is stopped or delayed. Most of the time, we forget the importance of theory of vital economy. What is the necessity of preserving the vitality for making the body able to eliminate the toxins and remove the disease, or say regain the lost health? We should also learn the meaning of vitality. You must know that vitality is the inherent power or energy deposited like a fixed deposit in our system, which cannot be increased during our lifetime, but it can be reduced or lost by wrong way of living, by smoking, by alcoholism, by overexertion, physical or mental. We will be losing not only the energy, but the reactivity of our vital power also. Likewise, due to abuses of health habits, once we lose our vitality or we expose ourselves to lowered vitality, the body will be getting into diseases or the stage of disease. We have studied that when the blood and lymph are adulterated with toxins, it results in lowered vitality, abnormal composition of blood and lymph, which ends in a disease. But prior to that, before a disease is performed by the body or shown by the body, the first stage is formation of toxins in our system, in our body. How does the toxins get inside our body? There are many methods. Physical reasons are there, or external reasons are there. Internal generated toxins are there. Toxins generated due to psychological reasons are there. Environmental toxins are also there. So, to stop the toxemia, we need to take care of a healthy environment. We need to take care of having a balanced mind, and we need to take care of a balanced lifestyle or a healthy lifestyle. When we speak of lifestyle, diet, exercise, relaxation or rest, mental peace, everything comes in picture. Only when we will be able to maintain the balance of all these necessities or the basic needs, we will be able to maintain normal health without leaving us to exposed to toxemia. When there is toxemia due to external, internal, psychological or environmental reasons, that means the body is polluted, whether at just intestinal level or internal in the bloodstream or further to the tissues and organs, and later to, say, endocrine glands and nervous system. So when the body is filled with toxins, if it is only within the GIT, the body's reaction will be through vomiting or diarrhea or causing a pain, intestinal pain. If we help the body at that stage, when the body creates the pain or diarrhea or vomiting, we will be completely healed, relieved from the entire disease. But if we consider only the symptom in vomiting or diarrhea or simple pain and try to escape from that symptom without giving opportunity to the body to heal, naturally there will be suppression. We will be causing suppression of the symptom, which will cause hiding of the toxin within. And later on, if the habits are not changed, the quantity and intensity of the toxin will increase, thereby more serious diseases, more serious symptoms will be produced by the body because the disease condition inside is growing gradually. It will spread to the blood and through blood to the organs, and then systems also may be, different organs also may be affected at a later stage. So the spread of disease is always due to suppression of the initial symptom, what we find at the early stage. So never suppress any symptom through any treatments. When Dr. Isaac Jennings met a patient along with his family members who had symptoms of fever, he was an allopath. He prescribed some medicines for all of them. But when he discussed with the family, the father of the family or the eldest person in the family, he just reacted that in my case, it is okay. Even if there is no medicines, let me try, since the fever is not very high. Let my family members take medicines and get well soon. All the family members were better. They got well by taking those medicines. And after a few days, when Dr. Jennings met the family again, because that time the family doctor system was also there, he was surprised that the head of the family, the father of the family, was also completely, perfectly all right. Then he asked, did you also share the medicine? He told, no, the medicine was just essential for my family members. I just took rest. I did not take any medicine, but I took complete rest because I was feeling chill. I just covered myself and rested on my bed. Only when I felt some thirst, I had some water. I did not take any food. And I went into a state what we call today fasting. But the physician was surprised how a fever or a disease can be cured without medicine. From there, he started experimenting, or say watching his patients to whom he was giving medicine. Then he found that with the same medicine, all the patients are not getting healed within the same period, same duration, within the same time, but they get cured at different times. And some people do not get cured. Some people die even if the medicine is given. So then he got a doubt whether the medicine is acting on the patient or the patient is acting on the medicine. He finally came to the conclusion that it is not the medicine that is acting on the disease or the individual, but it is the individual who is acting upon the medicine, which gives the effect of or the feel of healing. When we say that the individual is working on the medicine, we should also understand that the duration different individuals took to get cured. Why the earlier healed patient took lesser time and why the late healed patient took longer time? Because of the level of vitality to react against the medicine. The lowered vitality person took more time to get healed, and the person who had a better level of vitality could be healed earlier. So then the healing depends upon the vitality of the individual, not upon the same dose of medicine served to the patient. This was a primary thought from the example of that farmer whom he met initially when he could develop his ideas. Secondly, he met a typhoid patient who was tried with many of the medicines available that time, but with no improvement. Then he remembered the example of the farmer, and even he tried some medicines on this patient and he could not help the patient. Then he remembered the example of the farmer and he asked the caretaker to give a particular medicine, like few drops 4 times a day, and only pure water should be served other than this medicine. Actually, it was not medicine. It was again water filled in a bottle, but only in drops. He prescribed that bottle water or medicine, whatever he called, because to convince the patient and the caretaker that it is medicine, he acted that it is also medicine. But within 24 hours, when no medicine was served to the patient and when only water was served to the patient has shown some symptoms of improvement. Jennings continued his treatment with water upon that patient, and in 13 days, the patient was able to sit up on her bed, and gradually she came to normal condition. This gave a very great thought to Jennings, that it is not the medicine that heals, but body's own healing power. And when rest is provided, opportunity is provided, or when not even obstacle created through supply of drugs, medicine, the body uses the opportunity to heal. Thereafter, he continued his practice without giving any medicines or drugs of that time. And he found that the number of patients getting healed is on an increase, and the duration of treatment has come down remarkably. That means early healing. Similarly, the number of deaths also were less during his practice during the later stage. Finally, Jennings came out with a principle after a few years of practice, that if people learn and practice the healthy way of living, the doctors will have to close down their practice and return to farms and factories. This was a very strong revolution built up in his mind after watching his patients being treated without any medicines. Thereafter, he named our system of naturopathy initially with the name orthopathy, that is the right disease, that is disease itself is a process of healing, or the healing is from within the body, or the body heals itself. Vitality or the healing power is the real healer and not the doctor or the drug. So that way, the basic principle developed in regard to today's naturopathy, and then a system was built, a system was named, a system was begun in the name of orthopathy, a stand-alone system of medicine. His message was carried further by Father Sylvester Graham, Dr. R.T. Thrall, and many others at later stage. Jennings has written few books which are also available now. Once you go through, I will read out the names of those books. The Medical Reform, The Philosophy of Human Life, The Tree of Life, or Human Degeneracy. So the basic theory of today's naturopathy, what you learn in your classrooms, unity of disease, unity of cause, unity of cure, was originally originated by Dr. Isaac Jennings. You know now what is the theory of cause of disease or unity of cause. It is only toxemia. See how I call it mental toxin or toxins generated due to psychological reasons. How this can be generated? You can just imagine when a chemical poison is ingested into your body or consumed by you, there can be a toxin. But how mental toxins can be generated? When your mind becomes stressed, under strain or tension, the mind cannot work normally. That means the brain waves get changed. The function of the brain gets disturbed. And this will reflect through the nervous system, which will be communicated to the endocrine glands and entire organs of the body, by which there will be functional change. Even the eliminative organs will be affected due to the stress, strain, or tension. When the elimination is affected, there will be delay in elimination. As a result, stagnation of toxins, which had to be eliminated at a definite time, or say within a definite time. This stagnation further pollutes the blood and on the reverse process supplied to the organs, and the organs get more diseased. So when there is disturbance of the mind, the function of the body is affected and generation of toxin is possible. Similarly, external toxins from the chemicals, from chemical substances or chemical pollution, like air pollution,
Sir, you are not audible.
So your voice is not audible.
Sir, you are muted. You have to unmute.
Okay. Am I audible now?
Yes, sir.
Yes, sir.
And you have 3-4 minutes, sir.
How many?
Finish between 4 minutes or 5 minutes, it will be great.
Okay, okay. 1 second. So, when through different sources toxins are generated in the body, we need to escape from that toxemia, for which we need to give chance to the body to eliminate it. And the best way to give chance to the body to eliminate the deposited toxins is again fasting. There, you should understand what is true fasting and how it helps the body to eliminate. True fasting is total or complete rest, physical, physiological, sensory, and mental rest. When you provide these 4 kinds of rest, the body gets ample opportunity and chance, time, concentration, concentrating the vital power towards elimination and healing of the disease. So, when we practice the true science of fasting to heal the disease, the body works beautifully in very shorter time. Thereafter, we need to practice a proper healthy diet, which will help further elimination, which will not interfere with the healing system of the body. But here, when we speak of orthopathy, actually interference with different other treatments in today's naturopathy, like overexposure to hydrotherapy applications, mud therapy applications, and different other treatments, we will be losing the originality, the principle of applying orthopathy principle in treatment. That is why earlier when naturopathy was practiced, it was for almost 3 hours. The hip bath or mud application was given. Later it has come down to 1.5 hours. Then still later it came to 30 minutes. Now it has come to 20 minutes and 15 minutes. That is, we are nearing to the principle of orthopathy in practice of naturopathy. So overdoing of naturopathy treatments, which will affect the vital economy of the individual, will lead to lowered vitality again. So we should not cause lowered vitality in the name of treatment or different other modalities what are used today in naturopathy. This is very essential when you study about orthopathy. We can also see that other blessings of nature like sunlight, air, water, in moderate, when we use, it helps the vitality to perform itself, to cure itself. Like the findings of Arnold Rickley regarding air cure and sun cure. And similarly, moderate use of water, earth, or say food can help assist further healing after fasting. So conservation of energy is the basic approach we need to remember when we learn orthopathy. But when we deviate to naturopathy with different other treatments, we should remember that it should not affect the vitality, vital reserve, or loss of energy. That way, we will be able to complete the treatment with the help of fasting, a positive diet or healthy diet, and rational use of earth, water, air, and sunlight. So this way, I think when you study detail about orthopathy, and vitality theory, vital economy, you will be a practitioner of true naturopathy. Whereas if you deviate your attention towards only treatments, like treatment will cure the disease. It is something like a blind belief that drugs will heal or medicines will heal. It is similar to, or if you think that water is a healer, or water has healing power, or mud has healing power, it is similar to believing that drugs has healing power. It is the reactivity of the body that helps us to heal without drugs when we use water or mud, or even without water and mud when we allow the body and mind to relax completely, rest completely, or say perfect fasting when we perform. So this way, orthopathy can be justified. You should come across Hereward Carrington, Arnold Ehret. Ehret could not be healed, cured, helped by naturopathy hospitals also. When he left naturopathy hospital and returned to proper diet and rest and fasting, he could be cured. Similarly, Carrington has explained the theory of vitality, and then Tilden has beautifully explained the theory of toxemia. Try to learn the principles behind that, and then we will be able to reach to the real science of naturopathy, or the
Sir, you're again not audible. You can mute
Okay.
yourself.
Okay, yeah. Now it has come back.
Yes, sir.
My time is over.
Yes, sir.
Actually, you can finish it, wind it up.
Okay. Then if there are any doubts, they can ask me. Let me clear. Otherwise, you can close down. And thank you for the patient listening.
Thank you, sir. Truly said, when body heals itself, then why not to give it as an opportunity? Why not to take as a rest? Why not to give a time to heal itself? Why to go for medicines? Correctly said, sir. Thank you for your very informative words and your expert knowledge on orthopathy. We wish to hear you again in future. Thank you, sir. Thank you so much.
Thank you.
It said, knowledge always remains small if you hold it in your brains. But when you learn to share it, you realize how big it becomes. Now, our upcoming speaker has come to share his knowledge. We have amongst us very versatile personality, the gem speaker this evening, Dr. Bhargav Nani. Post his BNYs from SDM College, he did his MD in acupuncture, and since then, he has managed the subject of pain with his art of natural healing and acupuncture. He has been working as licensed acupuncturist on luxurious cruise ships. Dr. Bhargav is founder of Acupuncture Made Easy, through which he has shared his expert knowledge and experience among budding doctors in the world. Today, enlightening us on acupuncture, a natural painkiller. We welcome you, sir, Dr. Bhargav Nani.
Thank you. Check. I guess I'm, yeah, audible. Yep. Okay. Good evening, everyone. Can I share my screen, please? Okay. Yeah, got it. Yeah. Thank you for introducing me, Saraswati. So today I'm here to talk about acupuncture and how it works as a natural painkiller. Okay, and my name is Dr. Bairagarh. As you all know, many of you know me already, that you guys have um, learning acupuncture from me. But mostly I want to ask you, before I start the session, I want to ask you, like, how many of you feel that acupuncture is amazing? How many of you feel? I want this to be an interactive session. So put everything, whatever you have doubts or anything, you put it in a chat box, and I want to answer it in that way. Like, it should be interactive so that it won't bore. And this is going to be little bit longer, not much. But today, the takeaway, what you're gonna get is that acupuncture is actually a natural painkiller. When I refer that it is a painkiller, it means that it has a capacity, it has its own capacity, that it can treat much faster than the medications what you take. Usually what happens is, when you take a pain medication, if you are in pain, and it takes at least like 15 to 20 minutes so that it gets into the blood, and these chemicals act upon, and it can numb the pain actually, but it is not treating the pain. Yeah. But what here we can do with acupuncture is, we can treat it and we can also cure it. But there is a catch, that it also depends upon the condition, since how long you have it, and what exactly
ഇതിന്ന് പുറത്തു വരാൻ ഞാൻ നോക്കിയാൽ സാധിക്കുന്നില്ല.
uh, there is an audio, someone's audio is on.
Please continue, I am muted.
Yeah, so that's how. And it is quite common to find out, or told to be, with the doctors are unable to identify the real cause of pain. And patients are also like, even after various kinds of extensive examinations also, they couldn't able to find pain in some cases. Why is that? Because until and unless the damage is maximum happened in the body, it cannot be shown in the x-rays, it cannot be shown in the MRIs, CTs, or anything. We need to understand that. But the start of the pain in your body, which is, we call it as an acute pain, that's where we can treat it just like magic. Okay, I'm going to tell you how you can do that by the end of this. And most of the times when doctors cannot find what exactly is happening, then in that case, patients were often told, like, there is nothing wrong with you, or sorry, we can do nothing about it because we cannot find anything from the test, or you will have to live with it. Yeah, that's what, you will have to live with it. And it's all in your head. Sometimes some doctors also say that it's all in your head. But this is a poor practice, in among the doctors, to make such comments that they don't have to live with the pain. Who likes to live with the pain? No one likes to live with the pain. How many of you like pain here? No one, right? So that's what, who likes to live with the pain? No one. And living with the pain for the rest of the life is also miserable. Yeah, because pain is like, it's a highly unpleasant physical sensation caused by the illness or injury. Okay, it's a very unpleasant. Sometimes it can be acute, sometimes it can be chronic. There are types of pains, but I'm not going to go into the physiology of pain or anything, because I know that whoever has joined here, they are very good in understanding the physiology of the pain. But I'm going to touch the points according to the acupuncture, according to the traditional Chinese medicine. What is the main cause of pain? Yeah, the cause of pain according to TCM, like, whenever there is a lack of nourishment, there is pain. A few of you might feel that these some of the terminologies what I have used may be new for you, but I will make sure that you will understand it. Yeah, but when there is a lack of nourishment, there is pain. Yeah, understand that, which is nothing but nourishment is not there. So shortage of chi, it can be a shortage of chi, or it can be a blockage which has happened, the deficiency of the chi, or it can be due to blood deficiency also. And according to the idea presented in Ling Shu, okay, Ling Shu is a textbook. When chi and blood are lacking, it is easy to develop the cramps and pain follows it. Okay, so according to the TCM, it's when chi and the blood is lacking, it is easy to develop the cramps, and that follows the pain. Okay, and when the chi is deficient, it can't reach the blood vessels, because chi is a vital force, vital energy, which makes our body to function or organs to function and put you live according to the TCM. Okay, so if that chi is deficient, it can't reach to the blood vessels. So what happens then? The blood vessels will lack the chi. Okay, and the movement slow down leads to the stagnation, because there is no movement because of less chi. So the stagnation happens. So the generalized chi deficiency takes place because of the lack of chi. Then it weakens the heart, then arterial insufficiency will happen, then the lack of movement of the blood, or there is no adequate blood will be seen inside the body, like a circulation. So the circulation slows and becomes sluggish, or this leads to a blood stasis, because the blood movement is not happening, the circulation is slow, so the blood stasis happen, and meridians and collaterals become blocked. Okay, because we know that why you have a condition in your body, because if there is a chi energy which is blocked in the meridians or collaterals, that leads to the condition, and that condition we results in the pain. Okay, so when the blood and chi is harmonized, the meridians and collaterals flow smoothly. That's what we have to do it, because blood and chi is deficient or stagnant, so you have to harmonize it in the meridians and collaterals so that it flows smoothly, and this helps to restore yin and yang and resolves the pain. That's about like what exactly the cause of the pain according to the TCM, or according to this um, according to the TCM. Okay, and there is also like a patterns or a quality of pain. Okay, so each patterns we have in TCM, we have patterns. I know we don't study that in graduation, but you have to update your knowledge. You have to update your knowledge according to the world, what they are practicing in advancement of their techniques and all. So you have to make sure that you are up to the mark of this knowledge. So I'm gonna tell you about TCM patterns. Like if you have a sore pain, it is diagnosed, or the pattern is like, if there is a deficiency of blood and chi in any part of your body. Okay, in any part of your body, then you can have a sore type of pain. And if there is a chi stagnation, then you will have distending pain. So these are the types of pain what we study in the conventional medicine. Is same applies in the TCM also, but they have given you the diagnosis, like what exactly, which pattern makes that pain to cause. If it's a stabbing pain, then you will have a blood stagnation, after effect of the physical trauma. Like usually when the physical trauma happens, that's where you get most of the times the stabbing kind of pain. And at that place, what happens, the blood stagnation will happen. So that's leading to the stabbing pain. And sometimes you will have a sharp type of pain, and that is because of acute chi stagnation and blood stasis. And you will also experience throbbing kind of pain. Usually we'll see sometimes in the migraines or all migraines, because that is due to the toxic heat invasion, or heat is accumulated, or we can also say that hyperactivity of liver yang has taken place. Okay, and that is leading to the throbbing pain. So even if the sometimes you see pain comes and pain goes, then after 3-4 days again you get the pain. So that kind of pain we call it as intermittent pain, and that usually happens if there is a chi, blood, yin and yang deficiency because of that. Okay, and burning type of pain, that is also because of internal heat, or there is an invasion of exogenous wind heat. So whenever the wind heat happens, that attacks the liver. Okay, and when the wind heat happens, that attacks the liver will accumulate the heat inside in your body, and that causes the burning pain. Okay, and some of them who has fibromyalgia or generalized muscle aches and pains, body pains, they have like whole body pain, and that happens because of chi stagnation, blood stasis, or accumulation of damp chi and blood deficiency. And some of you also noticed when you're practicing physiotherapy or acupuncture, there is a radiating kind of pain in sciatica or in any cervical spondylitis or lumbar spondylitis, or when the nerve is getting pinched. So in that kind of radiating pain, the chi stagnation has taken place, and at the same time blood stasis also taken place, but the liver and gallbladder chi stagnation has also taken place. So this comes under the Zhang Fu. Okay, Zhang Fu organs, liver and gallbladder. So there the chi stagnation has happened. That is leading to the radiating pain. Okay, and there is also like a pain with the spasm and pain with the swelling, and that happens. Pain with the spasm usually happens because of the blood deficiency or invasion of exogenous wind, cold, or if there is a pain with the swelling, that means there is a damp accumulation. Damp is nothing but the fluid accumulation is there. It has been there, it's sticky there, it's not moving. The swelling is not getting reduced, or it doesn't have any movement. That's why we call it as a damp accumulation there. And there is also a blood stasis, because usually a blood stasis happen right after the trauma. And if you have noticed, like if you get hit where somewhere in your joints or in your bone, when you will have a fracture, so that has extensive pain along with the swelling. So if there is a swelling, then we will recommend them to go for x-ray to see whether there is a fracture or not. And that is a pain with the swelling, and that pattern is seen as blood stasis, which is following the trauma. Okay, and there is also toxic heat is building up. Okay, there is a toxic heat is also building up, and sometimes it also leads to a burning kind of pain. Okay, and so when I talk about mechanism, or when I say that acupuncture is amazing for pain, I need not to say, but you have to put it in your mind, or by the end of the webinar I'm going to make you sure that if anyone comes to you with a pain, first try acupuncture. Okay, first try acupuncture, because you will have a very, very promising results, that is for sure. And if you don't get promising results, there is something wrong in selection of your points. Okay, how many of you agree that acupuncture helps for the pain? How many of you agree that acupuncture helps for the pain? Okay, it's difficult for me to see. Yes, yeah. Yes, agree. Yep. You have to agree for it, because I will make sure that how it is going to be working. I cannot, sorry. Okay, Saraswati, can you make sure that I won't be the host, because I'm getting a lot of these disturbances here. So if someone is joining and I cannot open for a full screen.
Just a minute. Is it possible? One minute. I request Dr. Gulab to please look into it.
What happened?
Okay, cool. I got it. Sorry. Okay, it's because, see, you have made me a co-host, so I see that I cannot use some of these buttons here, because I am the co-host. That's interrupting my slides, but okay, I figured it out. Thank you. So I will talk about the acupuncture mechanism first. Okay, like, how many of you agree that yes, there are the meridians exist, and if there is a blockage or any sort of chi disturbance in the meridians, will only cause the pain? How many of you agree for that? Yeah. So transmission of pain impulse along with the acupuncture channels. See, most of the times the pain impulse travel along the same pathways as those of the traditional chi circulations, or we call it as a channels. It is an objective fact that the pain is always transmitted along certain pathways. And these pathways are closely related to the channel theory in traditional Chinese medicine. An interesting observation is that when acupuncture needling is used in the treatment of the pain, and when the needle sensation, which is called it as a dechi sensation, the higher the dechi, the more you get the clinical results. That is reported along a particular channel. Okay, so that has proven, and they have done this research in Fujian Provincial Research Institute of Traditional Chinese Medicine in 1979. They have done this research and they said that the pain can only travel through the acupuncture channels. Okay, it can travel only through the acupuncture channels, and that's where this research, based on this research, I am going to tell you an exact technique how you can make your acupuncture treatment like very effective, and it can work like a magic. And I don't want to talk about the gate control theory or anything, because most of you knows it, how the gate control theory works, but I have added a little bit more apart from that, like a caudate nucleus. And research has established that when the caudate nucleus is stimulated, the pain threshold is increased. Okay, which could increase the pain relieving effect of electroacupuncture or acupuncture, whereas inhibition of this caudate nucleus will decrease the pain relieving effect. Okay, so what you have to do when we need not to do anything, but when we give acupuncture, the caudate nucleus will get stimulated, and that will increase the pain threshold level. And when the pain threshold level is increased, automatically you feel like pain relieving effect is happening. And when the inhibition will happen to this caudate nucleus, then the pain relieving effect will decrease, and so that your pain threshold level is also decreasing, and you will affect the pain, you will feel the pain. And generally speaking, when the pain impulse enters the central nervous system, it can take a circuitous route to the cerebrum, because this caudate nucleus is in the center of the brain in the both the hemispheres. Okay, so the posterior horn of the spinal cord and the parafascicular nucleus are the two key locations in the reception and even the transmission of pain impulses. So that's where we are attacking, exactly where the pain is received and from where the pain has been transmitted. Though at that area we are giving a sensation to our brain in the caudate nucleus, so that will increase the pain threshold level. Okay, and we also do the stimulation of endorphins and dynorphins while giving acupuncture. Like acupuncture stimulates the brain's production of polypeptides and reduce the pain sensitivity. And scientists have discovered that the possible mechanism is that increase the release of natural pain relieving molecules known as endorphins by the brain. And these are very similar to opiates, such as like a morphine. Okay, but it is like 3 to 4 times powerful than morphine, these endorphins, and mostly the dynorphins, which is much more powerful than the endorphins are the dynorphins. Okay, and these are potent anesthetic agents. So usually in China or in Japan, if anyone wants to go for a dental surgery or they want to go for a cesarean session, so what they do is they do acupuncture first, then they stimulate the points with electrical acupuncture, or they stimulate with the natural stimulation or techniques of the acupuncture, and then they give this sedative effect or anesthetic effect, because the endorphins, dynorphins, serotonin is increased in the body, and then they perform the surgery, because they doesn't want anesthesia to be inside the body. They feel getting the surgery natural is much more effective, because it has less post rehabilitation therapy. Okay, so that's where they use it. And dynorphins are also members of the opioid peptide family. Their function is also related to learning and memory, emotional control, stress response, and pain, which is slightly, we are deviating from the topics. It's nothing but if you give acupuncture, it also helps in learning and memory, or to control the emotions, to control the stress, apart from the pain, because we are producing the dynorphins there by giving an acupuncture. Okay, and there is also a serotonin changes, and it is being found that the level of serotonin, 5-HT, one of the neurotransmitters with the greatest potential influence on the pain, okay, which is change in the correspondence with the degree of reported during acupuncture treatment. So this, they have done the research in Chinese Academy of Traditional Chinese Medicine in 1977, in 1978, and even in the 1979. That is to say that the higher the level of the 5-HT serotonin that is recorded, the greater the level of the pain relief. Okay, so the higher the serotonin levels, the greater the pain relief. And similarly, Zudinger, in 1980 has also reported that high serotonin levels can be detected in the thalamus, medulla oblongata, and midbrain when the electroacupuncture is used for sedating pain. Okay, so they have conducted the MRI studies while giving the acupuncture, and they have seen that high serotonin levels has been detected in the thalamus, in the medulla oblongata, and in the midbrain after giving an electrical acupuncture. So we can use that for sedating the pain. And acetylcholine changes also will happen when the pain threshold is raised by the use of acupuncture. The level of acetylcholinesterase is recorded in the cerebral cortex and cortex nucleus and hypothalamus. And when the threshold is artificially decreased, then they have noticed that there is a low level of acetylcholinesterase which is recorded. And this is also done research in Chinese Academy of Traditional Chinese Medicine in 1976, 78, and 83. And it appears that therefore that the level of the ACH also matters, and it also plays an important role in the relief of pain through acupuncture. Okay, so that's what happens when we give acupuncture. These all the chemical changes will happen, and even the catecholamine CA changes will happen. And they also seen that it indicates that noradrenaline is has effect on the pain relief, and the low level of Na recorded. And when they have raised, just a minute. Okay, so it is also very interesting to observe that the dopamine level is also increasing along with all these chemical changes, catecholamine and all these ACH and all. That also says that the less dopamine will cause a degeneration in the brain stem, and that causes Parkinson's. And so when you give an acupuncture, how we can help the Parkinson patient is by through acupuncture. It increases the dopamine levels, and that is making that dopamine level increase will help the patient from Parkinson's. And that has happened. And when the pain threshold is raised by the electroacupuncture, and in addition to the level of homovanillic acid, or one of the products of the metabolism of DA, dopamine is high in the midbrain and the hindbrain. They have also seen that the metabolism of dopamine can happen when we give the electroacupuncture by seeing the level, by noticing the level of homovanillic acid inside the brain. Okay, and in short, acupuncture achieves its effect by working with the body's own chemicals. We are not inducing, we are not adding a chemicals with the needle. We are just giving a stainless needle inside we are sending the pricking with the stainless steel needles, but body itself is stimulating its own chemicals, and we are not adding any synthetic chemicals. And this approach has several advantages over drug-based medicine. Because there is I'm going to say one thing. As we increase the sessions, your goal is to decrease the number of needles you used compared to the first treatment. That should be your goal. So whenever you give a treatment, you have to keep on decreasing, because if the size of the pain in the body, for an example, is this much, so it can become this much, very little bit small, when the patient comes for third or fourth session of acupuncture. So it keeps on reducing it. Okay, that's where the intensity is reduced, and it also covers, like if there is a generalized pain, then that becomes a localized pain, then from there it gets vanished. So remember that each treatment you give it, you have to decrease, you have to make sure that you're decreasing the number of needles, because that's where you know that the prognosis of the treatment what you're doing is working. Okay, but sometimes science in most of the conditions I have seen when I was in internship, that we are like a worshipping gods. Okay, what do you mean by worshipping gods? It's like patient treat us like a gods, but what happened is, like when we needle them, and we are not that confident that whether this works or not. So what you do, you go behind and you pray to the god, please let this patient have some relief. Okay, so that should not be the case. Okay, so like in a contrary, if you see that if a patient has a pain and they are prescribed with the pain medication, so the pain medication dosage keep on increases. Yeah, because the body is getting adopted, or it is getting it's getting addicted to that your body condition. And the more you raise the dosage, then only it can work for you, if not it doesn't. Okay, and that happens most of the times, because I have treated the patient who has who were taking morphine, or who were taking high opiates for a longer time, because they don't want to live with the pain, so they keep on rushing with that medications and all. And there is nothing they can do it, so they have done it, and I have treated them, and I have made sure that the medications will get down. Okay, it's the same way. The needle count should get down, needle count should not get increased. If the first treatment, if you're giving 12 needles, it should not become 15 needles for the next time, because you did not see any results. It should not be that. Okay, so make sure that you do it. And coming to the main part of this session, like we see now what is pain, and what is pain according, like what is the cause of pain according to the TCM, or what are the chemical changes or acupuncture mechanism which has happened. But now we will see what exactly you have to do, what technique you can do, so that you will release this pain immediately. Okay, so the health model of Chinese medicine is focused on the balance. It's always about the balance of energy, balance of blood, balance of yin and yang. It's always about that. So balance equals the health, while lack of balance equals morbidity and suffering. So the healing is restoring the balance. Okay, so if there is any sort of imbalance in the body, or imbalance in the chi, that leads to the morbidity and suffering. So what you have to do as a healer, you have to restore that balance. And how you can do it? You can do it through this Chinese medicine model. Okay, and it is under the practitioner's care to find the cause that lead to the individual to go out of the balance. So if you doesn't know what is the cause, how you can treat it? So it is your own responsibility to find out the cause first. You find the cause, you find the diagnosis, 50% treatment is done. Okay, 50% treatment is done. So if you doesn't find out the diagnosis, if you are not good at diagnosis, then you cannot expect the results. Okay, so you have to know what is the cause of it. And the purpose of acupuncture treatment for the pain is like, when the selected points on the channels is to tonify the deficiency, or to relieve the excess, or to balance the yin and yang, so as like chi and blood circulation and elimination of chi and blood stagnation will happen, so that you will get rid of this pain. And during the treatment, you can also add herbal remedies. You can add moxibustion, electrical stimulation, or body or point massage, like on the specific acupuncture point you're doing a massage, that can also help, or whole body massage, that can also help in addition to this acupuncture treatment. And etc. are also often applied simultaneously to strengthen the therapeutic results. What we are looking for is always the results. As a doctor, you have to see the results. If you don't see the results, you cannot say that no, I cannot do anything, you have to live with it. Nothing like that. You can see the results if you are doing it right. Okay, so now the main focus is on balance method acupuncture. This is the method which I usually use on the cruise ship, where I get 7 days of time to treat the patient, and I have to give a promising result because they spend a lot of money on the treatment compared to the land. So I have to be up to the mark, and that can be happen with this balance method. Those who doesn't know what is balance method, no need to worry, because I'm gonna quickly go through what exactly the method is and how it can help. Okay, and this concept is being introduced to the world by Dr. Tan. Thanks for him to give this method. And he said that this concept has been documented in classical old texts. Like they say that it's a Li Gan Jian Ying. So this whole balance method works on the principle called as Li Gan Jian Ying. It's nothing but if you stand a pole, if you put a pole under the sun, how fast you can see the shadow of that particular pole, that how fast you have to see the results when you insert the needle inside the body of the patient. It's simple because it's documented in the olden text. Okay, and that has to happen. So that is what the main principle of this balance method, that right after inserting the needle, you have to start seeing the results, and you will see the results. Okay, and this concept mainly focus on external symptoms like pain, aching, numbness, throbbing, stabbing. The one which I'm going to teach you, system 1, we have like 5 systems in the balance method. I cannot go all through it, but system 1 I can do it, which is like excellent treatment, excellent method of treatment to treat the pain or aching or numbness or throbbing or stabbing kind of pain. Okay, and distal points are used exclusively in all the systems of balance method. Okay, we don't use the local points. That being said, I want to know, like, if a patient has a pain on the knee, between stomach 35 and stomach 36, what could be the best point to treat that pain? If a patient comes to you saying that knee pain, what is the best point you can give to them to see the results? Yes, flood it in the chat box. What is the best point you can give for for the knee pain? If the patient comes to you with a knee pain, what is the best point? Stomach 44. Yes, keep on coming. UB 60. Okay, anyone else? GB 34. Okay, stomach 36 and in stomach 16, stomach 44, stomach 36. Okay, so you will be shocked with the answer if I give you like what is the best point to treat the pain if anyone has a knee pain. The best point to treat is LI11. It's a Gucci. Exactly, it's LI11. Okay, that's the best point for knee pain, and I will tell you how and why. That's how we do the distal method. We don't exactly prick on the pain area, because there is a saying that there is also a saying in a Chinese saying that if the baby is sick, you should not punish. Okay, if the baby is sick, you should not punish, which is nothing but if they are already having pain on that meridian, stomach 36 to in between stomach 36 and 35, and if you needle there, you're punishing it. Okay, so that's not the philosophy or principle of this balance method, because we always use the points which is away from the pain area, which is distal method. And with this balance method, it results in the rapid shift of the body into a state of equilibrium, because that is what we want. We need a balance. We need the chi should resolve, the stagnation to be resolved, the blood stagnation to be gone. and chi deficiency to be gone. And when that happens, the rapid shift will happen, and that will make you to have an equilibrium. And in the ancient text also, they said that the new jing, the limbs, these limbs are regarded, the upper limb and lower limb, they are regarded as a root, and the trunk as the branch. So if you want to treat the branch, if you have a back pain, you have to treat the limbs. Okay. But what happens usually, if anyone comes to you with a back pain, you're gonna put the needles on the UB meridian, on a GV meridian, but that's not the case in the balance method acupuncture. Okay, so the main concept is acupuncture 1, 2, 3. It sounds a little bit funny for the newcomers who doesn't know about balance method, but it has only like just 3 steps. Step 1 is you have to diagnose a sick meridian. Okay, what is a sick meridian? Step 1. So the patient has come to you saying that I have a pain in the lateral side of the knee. So it means you have to know exactly, you have to tell the patient to point out where exactly, show me with your finger where you have the pain. If the patient says that, yes, this is the part where I have the pain, maybe he says that the pain is on stomach channel. Okay, sometimes it can be only on the stomach channel, but sometimes it can be a multiple meridians involved. Sometimes there is no meridian passing from that area, from the where the pain is seen by the patient. In that case, you have to take the meridian which is very closest, and that we call it as a sick meridian. Okay, so that's the first step of your success in this balance method. You have to diagnose sick meridian, exactly where you have the pain. And step 2 is determining the treating meridians based on different systems. So as I told you, we have 5 different systems, system 1, 2, 3, 4, 5. Today, I will only tell you about system 1. So how you can treat according to that meridian, like if there is a pain in the stomach meridian, which meridian you have to select and use it. So that we will see in the first system. I will tell you in the next coming slides. And step 3 is it's about like point selection based on the mirror images and Ashi point. Okay, so now I will tell you why I have said you, if there is a pain on the stomach channel, why I have taken LI11, because according to the image theory, according to image technique, if you see, this is the image, the upper limb is considered as a lower limb. Like for example, the hip, the groin area, if there is a pain in the groin area, or that image exactly resembles like a shoulder, and this resembles like a thigh, and elbow resembles like a knee, and forearm resembles like a leg, lower leg, ankle resembles like a wrist, and this is the dorsum of your foot, and this is a sole of your foot. So that's how the mirror technique works. And you can also reverse the mirror. If you reverse the mirror, you can see like a finger in the mirroring format. You can see that finger is toes, but when you reverse the mirror, then the finger will be top of hip. It's nothing but if there is a pain in the top of hip, at the top of hip, which is sciatica, you can see in GB30 area, then you can needle in the finger and you can release the pain from the top of the hip. Okay, so in that way you see the image technique, and this image technique is throughout the body, not only with the limbs. Okay, it's like the image of the limbs to the head and trunk. Yeah, like if there is a pain in wrist, if there is a pain in the genitals, then either you can needle on the wrist or you can needle on the ankle. Any one you can take it. Upper limb or lower limb, it doesn't matter, but it has to be the most distal area. Then you can give it. And if anyone has pain in the umbilicus, okay, in the umbilicus, at the level of the umbilicus, then you can take elbow as an image, or you can also take a knee as an image, and you can prick any one of this part, and you can fulfill the criteria of this image technique. So in this same way, it's also like a reverse images, also reverse image of the limbs corresponding to the head and trunk will be there. I have listed out here. Later you can go through it. And even the image of the head also resembles, like for example, if I have a pain around the eye, then you can needle at the according to the image technique, you can needle either on the elbow or you can needle on the knee. or if there is a pain in the at the around the mouth or at the level of the mouth, you can do on the wrist or the hand, or you can do on the ankle and the foot. Okay, but I will tell you in the next slide, like where exactly, why, which point you have to select it also. Okay, and reverse image also corresponding to the head, you can do it. And scalp imaging also, like if anyone has tailbone pain, you need not to prick on the tailbone, or you need not to touch it. Okay, because they're already in pain there at that area, and if you touch that, if you prick the needle there, they're gonna jump from the bed. Okay, but if there's a tailbone pain, and according to this image format, scalp imaging, if you do on DU16, which is exactly in behind in the occipital area, if you do the needling there, that can relieve the pain, because the scalp imaging, the DU line exactly is image of the spine. And if you have pain in the cervical area like C3 and C5, then you can do the DU 24 to 22. Or if anyone has a pain in the lumbar too, like lumbar disc too, or the waist level, you can do on the DU 20, and you can treat it. Okay, that's the scalp imaging to the. This is a whole image, how it works, like what you have to do it. You should never do needling on the local points. And point selection is based on the image ashi to achieve the dechi. You have to see for this dechi sensation. Dechi sensation is like the first sensation what the patient experience after the needling. That's what matters. The highest the dechi sensation, the higher the results you get. Okay, so that's where the maximal energetic sensitivity will be there. And how you can find out? You have to find out in the step 3, the point selection. You have to find out by pressing the thumb at the area where they have corresponding meridian. Okay, I will tell you in the next slide also exactly why I have chosen that. Okay, so that's how the treatment effectiveness and the results will be driven, and they function in much greater capacity than that of a deadly painkiller. That's what I say. The higher the dechi, the higher the treatment for you. So before I'm sure that you might be aware of these acupuncture meridian anatomy names. Okay, I hope from today or from tomorrow, from today itself, if anyone asks, any of your colleague or anyone asks, okay, what treatment I have to do, what points I have to do, so you better, I say you better not to use small intestine or urinary bladder or Sanjiao or gallbladder. You need not to use that. You should not use it, because see, in India we use those names, but according to the other in another world areas, if you use that name, some of them, they doesn't know what is Sanjiao. Yeah, they doesn't know what is Sanjiao. Okay, so like that, so you have to use the universal acupuncture meridian anatomy names, or we call it as a pinyin names, like Tai Yang, Shao Yang, Yang Ming, Tai Yin, Shao Yin, and Ju Yin. Okay, Yang is nothing but the higher exposed to the sun. That's the meridians, which we count as when you are standing in the sun, the highest exposure of the sun happens, and where the meridian passes, that's a Yang. In is inside, where the less exposure of the sunlight will happen, and that we count as, those meridians are called as in meridians. So we have the hand meridians and foot meridians. Okay, we have the hand meridians and foot meridians. So it is like hand thigh yang, it's small intestine. Hand thigh in, it's lung. Okay, yang min, like foot yang min is stomach. Hand yang min is large intestine. So that's what you have to use these meridian names. Okay, and this is the channels like where the chi will be high or the blood will be high. I have a question for you, like why is Li4 regarded as the best point in TCM? Li4, large intestine 4, which is Hegu. That is the first point we learn about when you prick yourself, or when you start learning pricking, or that's the best point we say it till now in our practice. Why is that? So why is that? Because Li4 is Hegu, which is a starting point, which is a starting point of large intestine channel. Okay. Li1 is not a starting point. Li1, it's not at all a starting point, because that you will understand when you read about the pathways, that there is a small bump where you needle it. So that's where the chi will not escape other than that. Okay. So that's the entry point, or that's the exit point. That's the entry point of the chi in the large intestine. Okay. And why it is very much important clinically, because that is on Yang Ming channel, and Yang Ming channel is the only channel in all the primary meridians. Yang Ming is like, if it is a hand Yang Ming, it's a large intestine. If it is a foot Yang Ming, it's a stomach channel. This is the only channel in where you will see a lot of blood and you will see a lot of chi. You see, there is no other channel for that, like same these characters. So if anyone has a chi deficiency and blood deficiency together, if you prick on large intestine channel and stomach channel, then that can resolve it. Okay. So that's why Li4 has a highest clinical importance, but I don't use Li4. I use lingu point, which is 0.4, little bit inside towards the Li5, which is a lingu point, which comes in the first and second metacarpal. Between that, I use that point. That is the most best point for me. That comes under the master tongue technique. It has much more important, it is much more has chi blood than this Li4. Okay, just for your information. So after knowing the image, you know where exactly you have to prick, like how you can do it with the system 1. We are at the end of this, we are coming closer to the end of this. Please bear with me, it's been a long time, I know that. So the system 1 is Chinese meridian name sharing. Okay. So that's why I said why you have to learn the Chinese names, because without knowing the Chinese names, you cannot practice balance method. And why you insist you to practice balance method, because that is growing exponentially in the world. And if any acupuncturist from outside, if they ask you what acupuncture what method of acupuncture you practice, and you don't have an idea, you cannot say that I practice the acupuncture from the green book of Agarwal. You cannot say that. You have to know the technique what you are using it. So if you can say the balance method, then they will be shocked that you will be considered as an advanced practitioner, because that's how famous this balance method is. And unfortunately, most of them doesn't know about it from the BNYS, because it's not included in academics. But not an issue, you still have a chance to learn it. Okay, so sharing the same Chinese name, balance each other. So the question I asked you, like if the patient has a pain in the stomach channel, why I'm giving on the large intestine 11? It's because large intestine 11 is it's a hand Yang Ming, stomach channel is a foot Yang Ming. So according to the system 1, hand channels will treat the foot channels will treat the hand channels. That's how balance will happen. That's why if anyone comes to me with the knee pain on the stomach channel, I'm not going to prick on there. I'm going to prick on the large intestine, because according to the system 1, that is the corresponding meridian for the stomach channel. That's why I have chosen that. And the knee represents the elbow, and you know that through the elbow the stomach channel, large intestine channel passes, and the best point that passes from the elbow, which is an image of the knee, is Li11. So I have taken that. So I will find out Ashi point with the finger by pressing it with the thumb finger, and the most sensitivity, the patient says that yes, ouch, it's paining. So that's the point you have to prick it. So it can be on the Li11, or it can be slightly around the Li11, but you have to investigate, and you have to find out which is the most Ashi point, and you have to prick it. So when you do that, you will achieve the Dechi sensation. And when you achieve the Dechi sensation, it works like a magic. It has highest clinical importance, clinical therapeutic results, you're gonna get it. Okay, same way you can see like hand Taiyang, which is a small intestine, will balance the foot Taiyang, which is a urinary bladder. So if anyone has a neck pain around small intestine 15, between 15, small SI15 or SI11, SI15, then you can choose a urinary bladder. Like you can take UB60, because according to the image, the upper back, you can take ankle as an image in the reverse aspect to the trunk of the body, then you can treat it. And remember that if a patient has unilateral pain, if the patient is having pain on the right side, you should not prick on the right side according to the system 1. You should never prick it. System 1 is always opposite side. You have to, if the patient is having right side pain, you have to prick the needle on the left side. That's where the balance can happen. Okay, according to the system 1. Okay, in system 2, system 3, it's different. Yeah, so remember that. And if a patient has a bilateral pain, not an issue, you can still treat with both the sides, but you are not using the knee as a pricking area, you are using the elbow as a pricking area. Okay, so that's about the system 1. And this is a chart, like if anyone has pain in kidney, like ankle, okay, if they have pain in the kidney area in K3, then you can take heart 3 as a point, heart 7 as a point, sorry, heart as a point, heart 7 as a point, where the ankle is regarded as according to the image, the wrist is regarded as an ankle according to the image technique. Okay, so that's how you can treat it. If you have any questions, you put it. I know it is rushing, but still you can find the video, a detailed video in Acupuncture Made Easy, and you can find out in a detail what the technique is with all the 5 systems. Sorry, I'm too late.
Thank you, Dr. Bhargav. Here are the few questions.
Yeah.
How much effect does acupuncture have on mental disorders like epilepsy, OCD, and bipolar?
Okay, see, as you can see in the mechanism, I have already said you that there are the chemical changes which is happening, like serotonin, which is a happy hormone, or endorphins or dopamine is secreted through the acupuncture. So that needly, those sessions will take a longer time. Exactly, if anyone asks you, any patient asks you, like in how many treatments we can treat this condition, if you say that I can treat it in 10 sessions, if you say I can treat it in 5 sessions, then you are not a good healer, because you don't know how the body can respond. Okay, the treatment sessions should always happen according to the diminishing of those symptoms. Okay, so those kind of conditions, neurological disorders or central nervous system issues or psychological disorders, it takes a long time. There are some of the acupuncturists who is my colleagues, they have given the treatments for up to 200 sessions also, and they see the results. 200 sessions also. It's not like always. We have designed our mind through the college times that we give 10 sessions, so you're gonna get results. Nothing like that. You can get the results in 1 treatment, or you may get in 3 treatments or 6 treatments, or you may get it in 200 treatments. Yeah, it's always like that, but it definitely helps. It takes a little bit time for those type of conditions.
The next question is, can you please suggest acupuncture points for fever and pain management after COVID?
Yes.
Post-COVID.
Fever and pain management?
Post-COVID.
Yeah.
The person has already been infected by COVID, and after that.
Okay, yeah. See, what I have told you, the technique now is, it's a local balance. If the fever is involved, then that becomes a generalized. Okay, so for that generalized, you will have a static balancing, or you will have a global balancing, where you are using the 12 points, magical 12 points, and you treat the whole body. Okay, so if you are an acupuncturist, you put a message to me in my Telegram or in my Facebook page, then I will give you exactly magical 12 which will help in the fever. Okay, or magical 8 points. So that's advanced stage of this balance method. Okay. To learn.
Can we cure diabetes with the help of acupuncture?
Not exactly, not along, only with the acupuncture. But yes, it will help as an integrative therapy. It cannot be used as instead of diet or any other modalities. We cannot use just with acupuncture and do it. But in India, we don't practice Chinese herbal medicine, but in the foreign we do that, and we have sweet enough as a formula which I prescribe to the guest who has diabetes mellitus or any even type 1 also. So it works much more with because it's a the condition is a different condition. We cannot say that it will be relieved or it will be completely gone only with acupuncture. But as I can say that if there is a pain, it can relieve only with acupuncture. But there are other conditions where we have to do it. But definitely we do have a points for that. I use a global balance method for diabetes, and I have treated so many people. When I have prescribed, along with that, I have prescribed the Chinese herbal medicine and the diet changes.
Thank you, sir. Your session was really very informative. And you very nicely explained the mechanisms which acupuncture uses to treat pain. And when definitely you have a natural method of treating pain, why to suffer with pain or taking medicines and having side effects? Thank you. Thank you once again, Dr. Bhargav Nani.
You're welcome. Stop calling me sir, please.
So moving ahead,
You are mute, Saraswati.
am I audible?
Yes.
Yeah, well said. Sunsets are the proof that endings can often be beautiful too. Each sunset brings a promise of new dawn and a new morning and a new beginning. With these lines, we are at the end of our session. Now it's time to say bye for today. We'll meet tomorrow. Good night. Stay safe, stay healthy,